Next, let's talk about Medicare and UC retiree health coverage. This is what a Medicare card looks like. It is red, white, and blue, but I like to joke that it should be green because Medicare is worth a lot of money to a UC retiree. Medicare, for those who aren't familiar, is the federal health insurance program for most Americans over age 65, as well as some people who get Medicare before age 65 because they've been stricken by some disease like end-stage renal disease or ALS, or people who have been disabled for at least 24 months and get Social Security disability income for 24 months also get Medicare before age 65. There are multiple parts of Medicare. Medicare Part A is the hospital part of Medicare. It pays for facility fees when you're in a hospital or a skilled nursing facility. It's premium free for most people. If you paid into Social Security for at least 10 years, or if you married wisely, then you'll pay nothing for Medicare Part A. Medicare Part B as in boy, that's the medical part of Medicare. Medicare Part B pays for physician fees in and out of the hospital. It also pays for pretty much everything outpatient that isn't drugs, like ER, imaging, lab work, durable medical equipment, etc. And then, of course, Medicare Part D as in drugs, we'll talk about later. That's the outpatient drug benefit under Medicare. Medicare Part B is not free. It'll cost you at least $202.90 a month, more if you are super high income. Super high income is if you're in the top 7% of earners in the United States, I think it is. And that's if your modified adjusted gross, which is your AGI plus tax-exempt interest income from 2 years ago, was above a certain threshold. The MAGI is taken from 2 years ago because every year Social Security needs to set Medicare premiums, and they need to set premiums each January. But nobody's done taxes that early in the year. People have until April 15th. So that's why Social Security is always using 2-year-old tax information to determine who's high income. So in 2026, they're looking at your 2024 AGI, and if you filed singly, the threshold's $109,000. If you filed jointly on your taxes, the threshold is $218,000. If you are above those amounts, you might have to pay more for Medicare. But there is an appeal form that you can use if you've had a major life event like retirement. So for example, let's say your income exceeds these thresholds and you might have to pay high income premiums, and you get a letter from Social Security saying that you are responsible for IRMA, income related monthly adjustment amount, IRMA premiums, because they think you're high income. Well, if you retired since 2024, then that's a major life event that you could use to appeal premiums. If your 2026 income is expected to be lower than it was in 2024 because you retired, then there's an appeal form. If you go through me or you go through Nick, if you contact us 3 months before you turn 65, or if you are already 65 when you retire, 3 months before you retire, we will help you enroll in Medicare Part B. And when we do that, we will include a link to that appeal form just in case you're one of the high income people. If you are one of the high income people and you, even on appeal, have to pay high income premiums for Medicare, understand that you are a patriot subsidizing the less fortunate on Medicare by paying those high income premiums. You're subsidizing the low income on Medicare. So I hope that all of you pay high income premiums for Medicare because it means you're doing better than the rest of America. I believe it's only the top 7% that are charged more. But that's something that tax advisors and financial planners don't always think to tell you. Now you know. And it's easy to find Medicare premiums on Medicare.gov. Here's another informational logo here for you. Remember that when we talk about Medicare and UC health plans, it is UC's open enrollment that usually matters, not Medicare's. You're going to see all kinds of marketing around the Medicare fall enrollment period and the Medicare general enrollment period in January through March. those generally are useless to you as a UC retiree. You really want to just ignore the marketing around those open enrollments and the relentless marketing of the insurance companies who want to sell you Medicare Advantage plans and Medicare supplement plans. You don't need them. If you are retired from UC and you live in California, you have custom superior Medicare plans that you can access as a UC retiree. And if you move outside California and you're covered by VIA benefits, which we'll talk about later, then you might need to pay attention to some of the open enrollment periods. But again, the marketing, that's not how you should determine what medical plan you choose. You should choose the medical plan that's best for you in consultation with VIA benefits if you're covered by VIA benefits. Now, UC relies on Medicare to offset the cost of health insurance directly for retirees because our Medicare plans tend to cost less because Medicare is paying for a lot of the coverage, but also indirectly for employee coverage. If you think about it, Medicare indirectly subsidizes our employee premiums too, because the people who have Medicare, who are covered by Medicare as retirees, are kind of selected out of our risk pool. So if the people that Medicare covers are the oldest and the disabled and the people with, terrible diseases. These people are in a separate risk pool than the active employee risk pool. So when people retire or they go out on disability and they become covered by Medicare and their primary insurance is no longer UC coverage, then UC's risk pool is healthier. So it indirectly subsidizes our employee premiums. Medicare is just very, very important, which is why we have a whole section of this presentation just on Medicare. Now, most UC medical plans have a Medicare version. We call that Medicare version the partner plan. So each plan has its own Medicare counterpart. And this is important to know because this Medicare counterpart is what you're going to go to when you turn 65 and have Medicare if you're a retiree. Or if you retire past 65, that's the plan you'll go to when you retire if you're eligible. But it's also important to know the Medicare counterpart, the partner plan, for families where some members of the family have Medicare and some don't. I call that being in a mixed Medicare family. So either way, think of it this way. On your left, we have the non-Medicare plans. On the right, we have the Medicare plans. The Medicare counterpart, the Medicare partner plan to UC Care through Blue Shield of California, is a spectacular plan called UC Medicare PPO through Anthem Blue Cross. It's an Anthem Blue Cross Medicare supplement plan. So the Medicare version of UC Care is something much better. That means that if you have UC Care when you turn 65, if you're retired, you upgrade to UC Medicare PPO. Or if you're retired and you don't have Medicare, but your family member turns 65 and gets Medicare, this is the plan that they would have. So you might have UC Care and you might have Blue Shield, while your spouse has UC Medicare PPO and Anthem Blue Cross. That can happen. Similarly, when it comes to HealthNet, the UC Blue and Gold HMO, the partner plan is UC Medicare Choice, which isn't HealthNet, it's United Healthcare, and it's not an HMO, it's actual health insurance. It's a Medicare Advantage PPO through United Healthcare. Now we're going to talk a little bit more about what's a supplement, what's a Medicare Advantage plan as we go along, but I just want to set you up with this understanding before we get to the next examples. The partner plan for Kaiser is Kaiser Senior Advantage, a Medicare Advantage HMO. So if you're in a mixed Medicare family, some Medicare eligible family members might have Senior Advantage, while you just have what we call the regular commercial Kaiser. The benefits are a little bit different. There are some upgrades to the Senior Advantage, but it is a different plan. But this is the path forward for people who have Medicare. The non-Medicare plan becomes the Medicare plan. Next are we'll return to that bar chart. And the bar chart is now set back to 100% of the UC contribution. The gold bar is at 100. But we're going to skip the blue bar this time and focus on the red bar, a sample medical plan premium for someone who has Medicare. Notice that medical plan premiums for people with Medicare tend to be lower than they do for people who don't have Medicare, the blue bar. So we're going to focus on that red bar, which is a little bit higher than the gold bar. So there's a little bit higher, or a little bit of a net cost there to focus on in our next numerical example. Here we have example C, a Medicare partner plan example. So we have an employee who retires with 20 years of service credit. They're in group 2, and they get 100% of the UC contribution, same as the bar chart we saw in the previous slide. In this example, the retiree has UC care through Blue Shield of California when they retire. They are covering a spouse, and both have Medicare. Both of these family members, the retiree and their spouse, have Medicare. Well, the Medicare version, the Medicare partner plan of UC care through Blue Shield is UC Medicare PPO through Anthem Blue Cross. The total premium for UC Medicare PPO for 2 people this year is $1,145.20 per month. Now, the maximum that UC will pay for 2 people to have one of these plans as a retiree is $1,024.32, $1,024.32, which leaves a premium paid by this retiree of about $121. The difference between the $1,145 premium and what UC pays at $1,024.32, this retiree has $120.88 per month taken out of their pension check from UC. But that's not everything, because they and their spouse are both separately paying for Medicare. They're paying Medicare Part B premiums, each of them, at $202.90 per month. $202.90 times 2 is $405.50. Sorry, $405.80. Well, if they're paying $405.80 for Medicare and $120.88 for Blue Cross for the UC Medicare PPO, their total outlay is $526.68 per month, which, in my opinion, is a great deal, because the UC Medicare PPO is spectacular. This plan is so nice that you could get a $9,000 pair of hearing aids and fall down the stairs in Paris and get weeks of physical therapy on your torn rotator cuff before coming back to the United States for your kidney transplant, and you still wouldn't pay more than $1,500 all year, plus copays for drugs, which are low. And that's not even the best part. The best part is, because this plan is a Medicare supplement, this couple, their doctors rarely have to get prior authorization to treat them, because Medicare only requires prior authorization for certain infusions and maybe certain durable medical equipment like a power wheelchair and not much else. So these people have spectacular coverage for $526.68 a month, better coverage than I do for sure. And now back to the bar chart. This time we're going to focus on the red bar again, but notice that the red bar is significantly lower than it was in the previous example. The gold bar is set to 100%. This person gets 100% of the UC contribution. But this time, their medical plan premium, coordinated with Medicare, the red bar, is lower than the gold bar. When the red bar is lower than the gold bar, the difference is added to the retiree's paycheck. We call it Medicare Part B reimbursement. UC requires retirees to pay for Medicare. When they choose a medical plan that costs less than UC is willing to pay, we add the difference to their pension check to partially reimburse them for what they pay for Medicare Part B. Let's look at the numbers next. So this is how it looks in real numbers. Here we have example D, Medicare Part B reimbursement. Here again, we have a retiree who qualifies for 100% of the UC contribution. They're not subject to graduated eligibility. They are retiring with 20 years and are in group 2, so they get the whole shebang. This couple is retiring with Kaiser. So the retiree is covering a spouse, and in this example, both the retiree and the spouse have Medicare. That means that they have the Medicare Partner Plan for Kaiser, which is called Kaiser Senior Advantage, a Medicare Advantage HMO. The total premium for Kaiser Senior Advantage, $483.74 per month, significantly less than the plan premiums that we've talked about before. Kaiser requires $483.74, but UC is willing to spend $1,024.32. So there's money left over after UC pays the premium, because $1,024.32 minus $483.74, there's money left over. There's more than $500 left over. Now this couple has to pay for Medicare. They're each paying $202.90 per month for Medicare Part B, for a total of $405.80 between the two of them. But UC is going to credit them on their pension check Medicare Part B reimbursement in the amount of $370 a month. Okay, now they're not getting the full difference between $1,024 and $483, because the maximum reimbursement in 2026 is $370. But they are getting $370 credited on their pension check, and they have a zero premium for Kaiser Senior Advantage. They just pay for Medicare. UC reimburses them at $370. That means that their net cost is $35.80 per month, because they're paying $405.80 per month for Medicare between the two of them. But the retiree is getting a credit of Medicare Part B reimbursement of $370 each month, leaving a total net outlay of $35.80 a month. It's incredibly inexpensive to have Kaiser Senior Advantage. And we'll talk about what a Medicare Advantage plan is shortly, and that'll help you understand why Senior Advantage costs so little. As you can see, Medicare is very valuable, so UC has some requirements around Medicare for retirees, not employees, retirees. UC retirees and their covered family members must enroll in Medicare Part B if they're enrolled in medical insurance through the retirement system, and if they live in the United States, and if they are eligible for Medicare Part A for free, no premium Medicare Part A. I may have said this before, but if you pay into Social Security for at least 10 years or marry wisely, Medicare Part A should cost you nothing. So what you need to remember from this is that if A is free, I must have B if I'm a retiree. Feel free to repeat that to yourself, chant it to yourself. If A is free, I must have B if I'm a retiree, because that's how it works. There are exceptions. If you retired past age 65 but prior to July 1st, 1991, these Medicare rules do not apply to you. But otherwise, they do. If you want to be covered by UC as a retiree and you can get Medicare Part A for free, you must have Part B. Okay? And of course, we will help you with Medicare enrollment, Medicare coordination, and all of that. By just contact your local healthcare facilitators, Nick Robledo and myself. Okay? Now I want to give you a bit of a warning here. People who retire past age 65 but do not enroll in Medicare may be subject to lifetime late enrollment penalties by Medicare when they do enroll. Now UC is not going to cover you unless you have Medicare. So you need to take care of business and make sure that you've enrolled in Medicare as you retire. Otherwise, UC is not going to cover you very long. And Medicare, when you do enroll late, will assess lifetime late enrollment penalties. Medicare Part B's late enrollment penalty is 10% per year you failed to be enrolled or covered by group insurance through UC or another employer. Medicare Part D, as in drugs, also has a 1% per month late enrollment penalty for every month you were not covered by a creditable prescription drug plan through an employer or some other source. So you really need to pay attention to Medicare as you retire if you're 65, or if you have family members who are eligible for Medicare even though they're not 65. Even if they're eligible for Medicare younger than 65, they need to coordinate with Medicare and UC. If they can get Medicare Part A for free, even if they're not 65, they also need to enroll in Part B. So let Nick and I help you stay out of trouble with this. Call us, consult with us, we will help. Now, just to reiterate, UC does not require active employees or their covered dependents to enroll in Medicare. We have no rules around Medicare for active employees. However, I've got another warning for you. So you got the red triangle again. This time, it's for people who are covering domestic partners. Domestic partners of active employees need to check with Social Security to figure out whether they can defer Medicare enrollment without penalty. Okay? Many people who work for UC past age 65 don't enroll in Medicare Part B because they don't need it while they're working, but they enroll when they retire. If you are the domestic partner of an active employee, though, you got to check with Social Security because you may not be allowed to defer Medicare enrollment without penalty. Spouses, I'm not worried about, but domestic partners, I am concerned about. You need to check with Social Security before passing on Medicare Part B, because under federal Medicare secondary payer law, Medicare would be primary for you, and UC coverage as a domestic partner of an active employee would be second. And Medicare is going to require that you enroll so that you don't have a penalty later if you try to enroll at age 70 and having deferred Medicare enrollment at age 65, they're going to assess a penalty. So avoid the penalty. Consult with Social Security, make sure you're following the rules so that you don't have to deal with any late enrollment penalties that, by the way, apply for the rest of your life. So it is a serious consequence if you don't follow UC's Medicare rules and Social Security's Medicare enrollment rules. But again, stick with us and we'll keep you out of trouble. Keep in mind that you can be eligible for Medicare Part A for free through a current or former spouse. Even if you hate that spouse, you may qualify for Medicare Part A for free through that spouse, even if you yourself did not pay into Social Security. Okay? So you got to check. When you go to apply for Medicare Part A and you didn't pay into Social Security for enough quarters, enough credits, which it would be equivalent to roughly 10 years of employment, don't forget to mention your spouse's Social Security number, even if it's a ex-spouse or a deceased spouse, because you might get Medicare Part A for free. And of course, if you can get A for free, you must have B if you're a retiree or covered by a retiree. So there are two ways to coordinate Medicare with a health plan. You can either keep your Medicare or you can give it away. It's either or. Now remember, you don't necessarily have a choice when you're coordinating Medicare with your health plan, because when you do that, as you retire or after you retire, when you turn 65, you are simply enrolling in the plan that is the Medicare partner plan that corresponds to your non-Medicare plan that you started with. So you're not really making a choice here, but it is an either or situation. These plans either let you keep your Medicare or they require you to give your Medicare away. Now, if you keep your Medicare, then you keep original Medicare Parts A and B, but then you have a supplemental secondary plan that pays second and then you pay third. So Medicare pays first, the supplement pays second, you pay third. Or you give your Medicare away. That's a Medicare Advantage arrangement where Medicare pays a flat monthly fee to a private insurance company and then washes their hands of you essentially. So Medicare pays someone else to cover you, and the Advantage plan essentially replaces Medicare. So let's call Medicare Advantage plans Medicare replacement plans, if you will. So there are two ways that this is going to go. You're either going to keep your Medicare or you're going to give it away. And we'll now link that up to the partner plans as we go through the next slides. Now, many UC employees have HMOs because HMOs limit how much you pay for healthcare a lot better than PPOs do. So with HMOs, your Medicare partner plan is going to be a Medicare Advantage plan, which means you're going to be required to sign your Medicare over to a private insurance company. You got to give your Medicare away. Okay. Now there's a form for doing this. If you are retiring past age 65, it's literally going to be a paper form that you need to sign and attach a copy of your Medicare card to. If you turn 65 after you retire, this form would be an interactive form on UC Raise. But either way, you got to sign off on Medicare paying the insurance company. Now, when Medicare pays the insurance company to take care of you, because you've signed over your Medicare benefits to this plan that is going to replace Medicare, Medicare is going to pay them like $1,000 a month-ish, depending on where you are. So it's very valuable to the Advantage plan, this Medicare that you've signed over, which explains all the TV advertisements for Medicare Advantage plans that you may have noticed relentlessly parading across your television and on billboards, etc. So a lot of these insurance companies really want your Medicare. So they're going to try to sweeten the deal by offering low premiums and maybe some extras like free fitness clubs or something like that. So when you think about this, if you're in an HMO and you get Medicare, you're going to sign over your Medicare benefits to an Advantage plan. Then Medicare cannot be used separately from that plan. You're going to use that plan as if Medicare doesn't exist. So if you have Health Net and you retire and get UC Medicare Choice, you're going to go from the UC Blue and Gold HMO to the UC Medicare Choice plan with United Healthcare. You are going to tell Medicare to pay United Healthcare to take care of you, and then you're going to use UC Medicare Choice for everything. United Healthcare effectively replaces Medicare. Okay? Now, that also means that United Healthcare can require prior authorization for all kinds of things. Medicare Advantage plans can impose prior authorization requirements on your providers that Medicare does not. Medicare rarely requires prior authorization of doctors. They are experimenting with more prior authorization in 5 different states that are not California right now. But for now, and in historically, Medicare pretty much only requires prior authorization for infusions and certain durable medical equipment. And that's it. The doctors who treat you are free to control your health care when you have Medicare. But when you have a Medicare Advantage plan, like UC Medicare Choice, your doctors are going to have to get permission to treat you, which can delay or deny your care, if you're unlucky. The other Medicare Advantage plan that we offer is Kaiser Senior Advantage, which of course is the partner plan to Kaiser. So if you retire past 65 with Kaiser, or you turn 65 after you retire, we're going to switch you from regular Kaiser to Kaiser Senior Advantage, which means that you're essentially going to keep using Kaiser as if Medicare doesn't exist. And that's the way it works. That's how Medicare Advantage plans work. They replace Medicare. Now, the Medicare partner plans for UC's PPO plans are Medicare supplement plans. It's really just one plan called UC Medicare PPO, which means that if you're enrolled in a PPO plan, you get to keep your Medicare when you coordinate with Medicare. And then Medicare pays first, Medicare is primary, and Anthem Blue Cross plan pays second. It's supplemental to Medicare. And you pay third, if anything. And that's that UC Medicare PPO partner plan we talked about. If you are retiring past age 65, Medicare will not know that you have retired and will likely assume that they are not primary. So if you are going to retire with a PPO plan and you are a covered family member, are past age 65, then heads up. Here's the heads up informational logo. You'll probably want to call Medicare's Coordination of Benefits Department at 855-798-2627 after your last day on pay, not before you separated from the university, after your last day on pay, and tell them that you retired. Now, Nick and I will try to remind you of these things as we help you coordinate with Medicare, but it is hard to remember sometimes. It's still fixable even if you forget. You just have to call Medicare's Coordination of Benefits call center, get somebody on the line, update your employment status as retired, and the day after your last day on pay becomes the first day that Medicare is primary for you. And that's important when you have a Medicare supplement plan like UC Medicare PPO. Now, the advantage of this kind of coverage is that Medicare rarely requires prior authorization, so the doctors who are treating you control your health care. They don't have to get permission. They don't need to get permission to treat you or to test you or whatever, except for, remember, infusions and some durable medical equipment. Now, you must use Medicare providers with this kind of plan. Medicare is your primary insurance, therefore you must use Medicare providers, which makes sense. And you can find Medicare providers on Medicare.gov. But understand, the vast majority of doctors in the United States are Medicare. More doctors take Medicare than take private insurance because, most likely, Medicare doesn't require them to get permission to treat their patients all the time the way private insurance does. Only 1.2% of U.S. physicians who are not pediatric have opted out of Medicare. So probably every doctor you've ever seen that isn't a pediatrician is part of Medicare, unless they're a mental health provider. Now, of the 1.2% of physicians who have opted out of Medicare, a disproportionate amount are psychiatrists and mental health providers, which is a hassle. But long story short, if you're going to have Medicare as your primary insurance, you're going to want to make sure that your doctor is accepting new Medicare patients. If it's a new doctor, your current doctor is likely to continue to see you when you have Medicare. But if it's a new doctor, you might ask if they're accepting new Medicare patients. Again, to find Medicare providers, go to Medicare.gov. So if you have one of UC's PPOs when you retire, or if you are retired when you get Medicare, then the Medicare Partner Plan is going to be the UC Medicare PPO plan. So we have this weird situation now where if you don't have Medicare, you have Blue Shield of California. But if you have Medicare and you're retired, you have Anthem Blue Cross. You have Blue Cross and Blue Shield in the same family if there are some family members that don't have Medicare and some that do. Because those that don't will have UC care through Blue Shield. Those that do have Medicare have UC Medicare PPO. So those that don't have Medicare have a straight PPO through Blue Shield of California. Those who do have Medicare paying first, and then they have an Anthem Blue Cross Medicare supplement plan paying second. And technically, it is a PPO also, because UC adds some extra benefits to the UC Medicare PPO plan to cover things that Medicare doesn't cover, like hearing aids, acupuncture, services outside the United States. Now, if you're going to get hearing aids and you have UC Medicare PPO, Medicare doesn't cover hearing aids. That's the PPO part. That's where you want to use Anthem Blue Cross providers. So it is technically a PPO. But for most medical care that you get, you're just going to use any Medicare provider. Medicare pays first, Blue Cross pays second, you pay third if anything. Now, there's a lot more to know about the Medicare plans that UC offers for retirees that we're not going to touch in this presentation. If you really want to know more about plans like the UC Medicare PPO, Medicare Supplement Plan through Anthem Blue Cross, the UC Medicare Choice Plan through United Healthcare, the Medicare Advantage PPO, or Kaiser Senior Advantage, we go into great depth about those plans to retirees. So if you go to the Healthcare Facilitator Program website, you click on Presentations for Retirees, and you can find out more about those retiree plans that we don't have time to discuss in this presentation. But we do need to spend a little time on the new Health Savings Plus PPO plan offered by UC, because this plan is special. Health Savings Plus PPO through Blue Shield is a plan that is designed to be compatible with a health savings account, an HSA. And under IRS rules, you cannot contribute to an HSA if you are covered by Medicare Parts A or B. So that means that the Health Savings Plus PPO plan is incompatible with Medicare. Employees who retire with the Health Savings Plus PPO can't keep it into retirement until or unless they are covered family members have Medicare. Okay? So if you're covering a 65-year-old or eligible for Medicare yourself when you retire, you're going to need to switch out of the Health Savings Plus PPO plan as you retire. And you'll want to stop contributing to the HSA at least 6 months in advance of this enrollment. Because again, the IRS will not let you contribute to an HSA if you have any part of Medicare. And when you retire, if you're going to be covered as a retiree, you're going to need Medicare. So stop paying into the HSA for at least 6 months. That's a good rule of thumb before you retire with Medicare. Or if you do retire with the Health Savings Plus PPO, you can keep it. You can just go along with the Health Savings Plus PPO just like you were an employee until you or a covered family member become eligible for Medicare. And then, again, you have to change plans. It is almost like you have your own personal open enrollment if you have the Health Savings Plus PPO, retire, and become eligible for Medicare, because you can't keep that plan, but it doesn't have a partner plan, which means you get to pick any Medicare plan that you want. So strategically, if you want that option to choose any Medicare plan you want at retirement, you might want to be in this plan as you retire. Or if that's what you want to set yourself up for, is ultimate flexibility after you retire, and you know you're going to turn 65 in a couple years, if you position yourself in this plan, you could be pumping your HSA with pre-tax dollars, your health savings account, up until the point at which you need to switch out to another Medicare coordinated plan. And of course, I will help you with this. Nick will help you with this when the time comes. Call us 3 months before you turn 65. Or if you're retiring with Medicare, 3 months before you retire. Same if your family members are going to be eligible for Medicare. Call us 3 months prior, whether you're an employee or a retiree. Now, when it comes to this Health Savings Plus PPO plan, because of the HSA, it's not offered to retirees except during open enrollment. You can't get into the plan as a retiree mid-year, but you can choose it during open enrollment. And if you're an employee who retires with it, you can keep it until you can't. And when you can't is when you have Medicare. We talked about Medicare Part A, hospital insurance. We talked about Medicare Part B, medical insurance, earlier in the presentation. Now, let's talk about Medicare Part D. D as in drugs, which is the outpatient prescription drug benefit under Medicare. If you were enrolled in Medicare Part D, you'll know it because your ID card will say Medicare RX prescription drug coverage. This symbol tells the pharmacy that you have Medicare Part D. What I want you to think about Medicare Part D is that it is a way for Medicare to subsidize your medical plan premiums. All the UC plans that are coordinated with Medicare dropped in price as soon as Medicare Part D as in drugs debuted in 2006, because Medicare started to subsidize drug coverage. Prior to that, Medicare didn't cover outpatient drugs. People were on their own paying for drugs. Unfortunately, Medicare Part D makes things a little bit more complicated. And you may have seen some of this complicated language in your open enrollment materials and in other places on the UC websites and materials. Because Medicare has rules that try to prevent people from enrolling late or going without coverage until they need it. Because the function of insurance is to distribute risk. And if the healthy people don't pay in to offset costs for everybody else, then there won't be enough money to cover the sick people, right? So insurance companies, they want you to enroll when you're first eligible, not later when you break your leg, okay? So they put into place rules and penalties for late enrollment. We talked a little bit about how there are late enrollment penalties for Medicare Part B if you don't enroll timely. Similarly, there are late enrollment penalties for Medicare Part D as in drugs, but you won't be subject to late enrollment penalties for Medicare Part D as in drugs, even if you don't enroll in Medicare Part D when you turn 65, as long as you are continuously covered by prescription drug coverage that is considered creditable. Creditable coverage is coverage that is at least as good as a standard Medicare Part D plan. All UC health plans for any active employee, they all include drug coverage, and that drug coverage is considered creditable. So if you work past age 65 and you don't have Medicare Part D as in drugs, don't worry about it. You'll enroll in Part D when you retire. Because if you don't enroll when you retire, you might have to pay those late enrollment penalties I mentioned before, 1% per month for every month that you forego creditable prescription drug coverage. Okay? Now, when you enroll in a Part D plan, D as in drugs, after you retire or as you retire, I should say as you retire. Let's say you retire at age 67 and you sign up for a Part D plan through UC, and that plan has no idea whether you've had creditable prescription drug coverage from age 65 on. Well, they're going to need to ask you because they're going to need to figure out if you have to pay a late enrollment penalty. Well, the way they ask you is to send you a scary letter that says we have to charge you late enrollment penalties unless you were covered by creditable prescription drug coverage from age 65 on. And we don't know whether you had drug coverage that was creditable from age 65 to age 67. And they'll want you to return a form that says that you had employer or union coverage or whatever. I encourage you, if you're going to retire from UC past age 65, this could come up for you. Not necessarily. In some situations, they may know that you had creditable coverage. But if they don't, they're going to ask you. And you need to respond, because if you do not respond, they're going to charge you late enrollment penalties. Don't let that happen. If you get a letter after you enroll in a Medicare Part D plan as you retire that is talking about late enrollment penalties if you don't have creditable prescription drug coverage, I want you to call that medical plan and let them know that you had a UC health plan, whether it's Kaiser or HealthNet or UC Care through Blue Cross or Blue Shield or whatever it was. You just need to tell them what the plans were over the years that you had coverage through UC so that they don't assess you a late enrollment penalty. So this is important. I know when you retire, you're going to want to go traveling. At least that's been my experience with new retirees. But you need to be paying attention to your mailbox because you don't want to end up with a lifetime late enrollment penalty, and you don't want to have to appeal a late enrollment penalty either. It's too much work. You need to have somebody checking your mail, even if you're going to be here, there, and everywhere, traveling right after you retire. Make sure somebody is on top of your mail so that you can call your health plan and let them know about your creditable prescription drug coverage if you retire past age 65, if they need to know. There's more to know about Medicare Part D, and I may have mentioned a little bit of this before, but when it comes to vaccinations, Medicare Part D as in drugs was created to pay for outpatient prescription drugs, but it doesn't pay for the administration of drugs, the injection of drugs, for example. So Medicare Part D makes things a little bit complicated because it covers drugs, but not their administration. The administration would be covered by Medicare Part B as in boy most of the time. There are exceptions to this. In fact, Medicare Part B as in boy covers drugs that you might get infused in a doctor's office. So not everything is predictable. It's complicated. So trust me when I tell you that if you're going to retire and have a Medicare plan, when it comes to vaccinations, if you're going to get a shingles shot, please do not get it at a doctor's office because you'll have to pay up front and submit claims for reimbursement, and it's going to be a big hassle. But if you use your plan's pharmacy, it should cost you nothing. And there are 2 shingles shots. It's usually in 2 phases, as I understand it. If it comes to flu or COVID shots, you can use either your MD's office, your PCP's office, or your network pharmacy, and that should work. I'm okay with the doctor's office for flu and COVID, but for most vaccinations, you're going to want to use your pharmacy so that you don't have to pay up front and go through the trouble of requesting reimbursement. For other vaccinations, check with your plan if you're not sure, but you're usually safest getting your immunizations, your vaccinations, at your network pharmacy. Now, we talked about how Medicare Part B as in boy has high income premiums known as IRMA, Income-Related Monthly Adjustment Amount, IRMA. Well, there are IRMA premiums for Part B as in boy and Part D as in drugs if you are high income. But normal income retirees, most of our retirees pay nothing for Medicare Part D as in drugs. Their premiums for their drug coverage are just part of the regular premium that they pay. There's no separate charge. But if you're high income, yes, there is an IRMA Part D charge that is separate that you'll have to make sure that you pay so that your Medicare drug coverage is not canceled. Because remember, Medicare subsidizing your coverage, it's very important that it's in place. Medicare Part D also complicates or prevents double coverage. Because heads up, you cannot have two Medicare Part D drug plans. Why? Because Medicare will not pay twice to cover you for drugs. You also cannot have two Medicare Advantage plans at the same time for the same reason. Medicare won't pay twice to cover any one person. So that means that if you're covered by one of our very nice Medicare Part D retiree plans, all of our plans, except for one special plan, cover drugs through Medicare Part D. If you have our plan and then you also sign up for a plan through your spouse's retirement, or you fall for the sales pitch of somebody selling Medicare Advantage plans or Medicare Part D plans, Medicare will start paying that new plan and stop paying your UC Part D plan. So don't do that. You can do that, but you shouldn't do that if you want to retain UC coverage. Medicare is coordinated with your UC plan. If it becomes uncoordinated, you're going to lose your UC coverage. So it's a problem. So be careful with it. Again, lean on me, lean on Nick. We will help keep you out of trouble. If you're not sure about what to do, or confused about something that comes up, or that you've received it in the mail, just give us a call. The best way to reach us is by phone. Now let's talk about Medicare retirees who move outside California. Now I said move, not travel, okay? If you move outside California and you change your home address to something that is outside California but within the United States, and you and all covered family members are age 65 or older and have Medicare, then UC isn't going to let you keep your Medicare, your custom Medicare plan that we've talked about. You're not going to get to keep your UC Medicare PPO, your UC Medicare Choice, your Kaiser Senior Advantage. Instead, UC is going to send you to this giant insurance broker called Via Benefits. Via Benefits will sell you individual policies like anybody who has Medicare can buy in whatever state you land. So you'll be saving UC money if you move outside California, because UC will help you pay for your coverage by providing up to $4,000 per covered person. That is subject to graduated eligibility. So if you get 50% of the UC contribution, then you'd only get $2,000 per covered person each January in a health reimbursement arrangement account, an HRA. UC is going to put money into this HRA instead of covering you directly, which saves UC money. Now, you'll be able to choose from lots and lots of different plans that are available across the country, and that's going to vary depending on what state you're in. You'll have a lot more choices outside UC coverage. You'll have more choices through Via Benefits, but you won't be able to keep our custom plans if you change your home address to something that's outside California. So if you're going to be bi-coastal, if you're going to be a snowbird and live in two parts of the country here and there, you're going to want to keep your home address with UC. You can have a mailing address anywhere, but your home address needs to be in California. Otherwise, UC is going to send you to Via Benefits. Remember, when all covered family members are 65 or older and have Medicare. It only applies to families where everybody has Medicare and is 65 or older. And this Via Benefits coverage does not affect your dental, your vision, your legal, etc. Medicare doesn't pay for any of those things. That coverage will remain the same, but your medical coverage through UC will stop, and you'll get individual policies through Via Benefits, the giant insurance broker, who can sell you Medigap plans, which are Medicare supplement plans, and they can sell you Medicare Advantage plans, and they can sell you Medicare Part D drug plans, and that kind of thing. Then whatever plans you choose, you're going to use UC's money to reimburse yourself for what you pay for Medicare, Medigap, Medicare Part D, Medicare Advantage plan premiums. The idea is that UC isn't going to cover you directly, but we're going to offset the cost of your premiums. Now, if you choose inexpensive plans and there's money left over in your HRA after you've been reimbursed for your premiums for Medicare, Medigap, etc., you can use the HRA money for other eligible healthcare expenses like dental work, glasses, prescription drug costs, other eligible healthcare expenses. Now, I want to give you a heads up. If you have Kaiser and you're going to move outside California, please give us 2 months lead time before you move. It takes UC a couple of months to get you into VIA benefits. So I want to make sure that you're in a situation where your plan changes when you move so that you can actually get medical care that isn't an emergency without waiting, okay? Kaiser will cover you for emergencies anywhere, but let's say you have needs that aren't emergent, you're going to want to have coverage that works where you are. So try to give us 2 months lead time so that we can time that all out. If you have UC Medicare PPO or UC Medicare Choice and you move to some other state, well, you can just use those plans in any state, just like you can in California, until we switch you over to VIA benefits. So we have time to get that done. Not so with Kaiser, since Kaiser's an HMO. You have some urgent care with Kaiser out of state. You definitely have emergency care, but we want to make things smoother. So if you're going to move out of state and you have Kaiser, give us at least 2 months lead time. But regardless, if you're going to move outside California after you retire or as you retire, please give us a call. We deal with this stuff every day. We can help you transition to VIA benefits coverage. We can prepare you for it. We can tell you what to expect. And crucially, we can help you with the paperwork and make sure that it gets to the RASC and that kind of thing. So lean on us when you enroll in Medicare and when you move. We're here to help you with those major life events. Not to belabor the point, I've already said that you should call us 3 months before you turn 65 so that we can help you with Medicare. But it bears repeating that you should call us 3 months prior to turning 65, whether you're an employee or a retiree. We deal with Medicare every day. You only turn 65 once. So let us make this easier for you. Call me, call Nick, and we will help you enroll in and coordinate Medicare with your UC coverage. If you're an employee, we'll tell you that you don't need to do anything with Medicare, but here's what you might want to think about. And then we'll help you understand the enrollment process and how things work. If you're a retiree, there's a lot more to do. We're going to make sure that you know how to enroll in Medicare and that you do the paperwork or the interactive form on UC Raise that gets you where you need to go, and that is to your Medicare partner plan. Or if you have the Health Savings Plus plan, we're going to help you with the paperwork and help you understand your plan options that are any of the Medicare plans that UC offers. Remember, when you're retired and you get Medicare, you don't get to choose any old plan. You're going to go to your Medicare partner plan based on the plan that you're currently enrolled in, unless you're in the Health Savings Plus plan, and then you will, because that plan doesn't have a partner plan, you get to choose any of UC's Medicare plans. Nick and I can help you with all of that.